Hello and welcome to another episode of PsyWicV. My name is Huy. This is the second episode in a series of 5 episodes about anxiety disorders. And in this episode, we're going to talk about managing anxiety disorders. Let's go.
Luke is a 28-year-old single male who came to counseling because he noticed that he had been more withdrawn and feels significant anxiety before leaving his house each day. He is working as a waiter and working on completing his college degree in computer programming. In the past, he enjoyed being around his friends. Sometimes experiences stress because of school and work-life balance, but he has been able to handle it in the past. He reported that he's felt much more anxious since his visit from his parents' home. On his drive home 2 months ago, he realized that his parents were getting old and that he is without a career. He does not want his parents to pass without seeing him settled and successful. He also has been thinking that his friends no longer value him because he has nothing to show for it, so he avoids seeing them. During his first counseling visit, Luke disclosed that he had started also feeling more anxious about going to work, and he pushes himself to go to work because he needs to earn the income. So he decided to begin seeking treatment.
Luke is developing symptoms of social anxiety, feeling embarrassed, humiliated, rejected, or looked down on in social interactions. Luke likely has experienced some anxiety in the past, but it has not impaired his function until recently, which appear to have been triggered by thoughts associated with his parents. Most people, like Luke, seek treatment when they can see that their anxiety is affecting their ability to live a quality life.
What I find most common is that family members will step up in order to provide help for a person experiencing anxiety. So the person experiencing anxiety doesn't need to do any work on their own. Imagine if Luke was married and his wife earned an adequate income, and she may say to him, if you are too anxious to go to work as a waiter, then you can take a break and don't worry about working. Or if you don't want to go out with friends, we can just spend more time together at home. If this was the case, Luke would have less desire to change. The truth is, Luke needed to change because he needed to continue working, and so he needed to overcome his anxiety and to regain some of his prior functioning. And within 2 months of treatment, he was able to regain a lot of those skills.
CBT is short for Cognitive Behavioral Therapy, and it is one of many counseling theories. CBT helps you identify and challenge the negative thinking patterns and irrational beliefs that fuel your anxiety. Part of CBT is exposure therapy, which exposes you to your fears and anxieties in a safe, controlled environment. Through gradual exposure, either in your imagination or in reality, you gain a greater sense of control. As you face your fear without being harmed, your anxiety will diminish. We want to stress that it is important to seek help if you are starting to avoid certain situations and you notice that it has started to make life inconvenient for you and affecting your way of life.
So how can you best support your loved ones if they experience anxiety? First, encourage them to go see a primary care doctor in order to do an actual physical, make sure that those symptoms are not caused by medical concerns. Second, listen to their fears without judgment, because fear is based on interpretation and perception, and that's different for everyone. 3, encourage them to face their fear slowly and progressively. 4, encourage them to seek counseling as soon as possible. Anxiety does not go away on its own without being managed well. It usually progressively gets worse. We want to caution you because we see this a lot. Most people who experience anxiety go to a primary care doctor and gets prescribed a medication to help with their symptoms. Their symptoms improve at first, but then over time they build tolerance for the medication, and the medication then becomes less and less effective. Most of my patients come to me for therapy after having been on medications for several months. They acknowledge that they do not know how to cope with their anxiety without medications. Medications can help reduce your symptoms of anxiety temporarily, but they do not help you regain skills and create new memories in order to challenge the old ones and also improve your quality of life.
Anxiety is a byproduct of living in a turbulent world. There's a lot of things to worry about. Having worries, doubts, and fears does not make you a second-class Christian or a defective minister. Instead, worries, doubts, and fears are opportunities to drive us to greater dependence on God, to greater compassion to people who struggle. We all struggle on this side of heaven. Deep problems don't have quick solutions. God is patient because love is patient. There's no quick fix for this. So instead of pushing for quick fixes or rushing our brothers and sisters to get their act together so our life is unencumbered by their struggle, try to start with humility. Let's start with helping them name what's troubling them, and then remind each other of God's grace and truth. He's near. His grace reaches to the depth of our struggle. We can cast all our anxiety on God because He cares.
And with that, we wanted to offer you information on anxiety. Look for future videos where we talk in detail about anxiety disorders, different types and medicines, and how to cope with anxiety if you experience them yourself. Thank you for watching our channel. Thank you for spending the time to watch this video. If you like this video, give us a thumbs up, subscribe, and we look forward to seeing you soon.